Welcome to another edition of the Reidsville Chamber of Commerce News and Views Show. I'm your host, Diane Sawyer, President of the Reidsville Chamber. And today we have with us Angie Orth, President of Penn Hospital. Welcome to the show, Angie.
Thank you. Thank you so much for the opportunity to be here today. Really appreciate the opportunity to talk with you about the exciting things that are going on at Penn Hospital and our wonderful facilities that are part of Cone Health.
Awesome. Well, you're excited to have you. Tell us a little bit about yourself and how you ended up here at Penn and sort of your background.
So thank you for the opportunity to be here. It's been really great to be part of Cone Health, Penn Hospital. I was asked to come to Reidsville in August of 2021 during the height of COVID. We were in the midst of responding to the Delta variant, which ultimately became Omicron, and it's been almost a year since I've been here. I am actually from Greensboro. I grew up in Greensboro, raised my family there. I'm married to Keith, who was a long-term employee of United Parcel Service. He actually drove a truck for UPS for over 30 years. We raised our children in the Greensboro High Point area, specifically High Point. We lived there for many years. I attended UNCG for my undergraduate in psychology and went to Wake Forest to get my MBA. But I started at Cone actually and entered the industry as a very young person. I started as a cashier in high school at Moses Cone Hospital, the flagship hospital in Greensboro. And so that was my introduction into the industry.
That's awesome. I love to hear stories about that and how things come full circle for people in their career. So I know that, so there's a lot of meat even just in your background. So let's talk a little bit about what's new with Penn, because I know that, and we can talk about the COVID response too, and that was the big thing, but what's new? What things do you want people to know about that's exciting, that are good new services or new projects or things that you're working on?
Right. Well, the hospital is just incredibly vibrant. For a rural community hospital, we have a lot of volume, a lot of patients, and a lot of services. In the specialty area, what I'm really excited about is that we continue to add physicians, continue to add specialties to our market. Most recently, we added 2 new gastroenterologists to Cone Health Medical Group. They're working in an outpatient practice along with doing procedures at the hospital. We have a new orthopedic surgeon. We have a new urologist that's getting ready to start, and we're adding a lot of new primary care physicians along with advanced practice providers, which are nurse practitioners and physician assistants. So we're trying really hard to ensure that our community has lots of services so that we can keep care local. In addition to that, we've offered some new technology. We have a brand new MRI scanner, which is actually the most updated scanner in the Cone system, so we're excited about offering that. And I should mention also that we have a really vibrant skilled nursing facility. We have a 91-bed nursing home that's been actually in this community for many years, but they keep a pretty high census at the Penn Center, and so I'm really excited to see that we can serve our community in that way.
It is such a great thing to be able to serve on all of the levels, and I think you said it very appropriately, keeping the services local, right? Because that's something that our community has struggled with throughout the years, from when Penn was an independent hospital, and then when we became part of the Cone system. That was one of the things that we were most excited about, was access to those services. But being able to go to the doctor right here in Reidsville, with the way that the local services being offered, the current economy, right? Like driving to Greensboro, I mean, that you're saving folks quite a bit of gas and time and effort. And, a lot of people overlook taking care of themselves. And with businesses, small businesses, industries being short-staffed, I'm sure it's even harder for folks to get the time they need to see that. So you offering those services is a huge thing for our community and for people to be able to do that. And you mentioned primary care, which we just had a ribbon cutting for Reidsville Primary Care and for that practice. And a lot of people, I mentioned this at the ribbon cutting, a lot of people don't know that my background is public health education, and I also went to UNC Greensboro. And it's so important, right, for people to have a primary care facility that they can go to, that they have a medical home, because medical home is such a big deal. And for y'all to offer that, you know, we have several private practices, but for Cone Health Medical Group to offer that here to our residents, what a huge need they are filling, and what a burden they're taking off of the urgent care and off of the ED. I mean, it's just such a wonderful thing that you all are able to work together and partner through those things.
Yeah, we're really proud of that. We really are, and partnering with the community so that the community feels cared for. One of the objectives that we have, strategic initiatives that we have, is to, in addition to keeping care local, is to really move from success to significance, meaning that Cone Health has had a long history of success, and we want to continue that success, but we also want to be significant in the communities in which we serve. And so one of the ways we're doing that is we're spending more time planning on wellness initiatives. So in healthcare, we have responded to chronic disease, acute illnesses. That's been really the way in which we've entered into our patients' lives, is that when they are in a chronic state with their illness. And so what we really want to do is we want to provide services into the future where we are connecting with our community in a way where people are able to feel well. Whether that is better eating habits, or whether that is providing medications, making sure that there's food available for individuals to have in their home, making sure that they have transportation to facilities, having access to facilities that are very close to where they live, offering telehealth visits. So those are the types of things that we're putting in place. And chronic care will always be available. The hospital will always need a hospital where patients can be hospitalized, but we also recognize that there are many, many more things that we need to put in place so that communities are healthy.
Absolutely, and that goes back to my past career and the things that I was doing, and I think that for the community to understand that you care about their holistic approach to wellness and the whole circle, right? And the spiritual and the all of it, right? And so we covered all these things that you're doing, and we actually just also had a ribbon cutting for the chapel, in which you provide a chaplain in the hospital, and we dedicated it to a very wonderful lady who was the previous chaplain, and now you have someone in place to take that legacy and move forward, because Annie Penn is known for having somebody that folks can pray with and can sit with and can advocate for them in all of those ways, and just kind of completing the whole circle of wellness. I think that the opportunities that you're offering in the community, I mean, even things like partnering, you know, the City and the Y partner, and Annie Penn has sponsored many times the Fitness on the Square, and the opportunities for people to have a better quality of life and a better lifestyle, so that they're not needing you in such a chronic manner. And like you said, you're always going to need the hospital, and we're always going to have emergencies, and we're always going to have things that are beyond where they are and needing the doctor. But if we can start to prevent some of those things, because we're in a very odd place coming through the pandemic, and we're on the other side of that, trying to manage kind of post-pandemic, but still all the other things that were happening. So let's talk a little bit about the response. And I know you mentioned you came right when the Delta variant, but as a total, let's talk about Annie Penn's response to COVID and how that sort of transpired and bringing us to present.
Sure. So you're right. Back last year when I started at Annie Penn, we were in the midst of the Delta variant, as I had mentioned. And at that time, Annie Penn had the opportunity to really ramp up and begin to admit patients to the hospital. So in the early response, patients were admitted to Greensboro, to the COVID hospital that was created in Greensboro by Cone Health, and that facility was wonderful. During the pandemic, there were many times when we thought that we were over sort of a wave and we might be coming out of it, and unbeknownst to us, there was a wave right behind it. And so At the time when I joined Annie Penn, we actually had made a decision as a health system that the hospitals would begin to admit patients to their own hospitals, and that the Greensboro facility was no longer going to be able to do that for various reasons. And so we began to do things like educate our staff on how to care for COVID patients, increase our PPE, or our personal protective equipment. We added negative pressure rooms to the campus, and changed our processes so that we could care safely for patients that had COVID. So that ramping up we had to do fairly quickly, and we were successful at it. And for quite a while we had a pretty significant number of patients in the hospital that were COVID positive. Now, fast forward to today, our numbers have decreased, fortunately, and we're in much more of a maintenance stage. We will, I think, have COVID for some time. With the new technologies, the new immunizations, masking, hand washing, all the things that we have learned from the pandemic, we're able to manage the illness somewhat on an outpatient basis now, and many patients stay home. So that has allowed us really to get back to normal to a certain degree. And what we're seeing is that a lot of the surgeries, endoscopies, things like that were put on hold. Now we've opened back up for business, and we're finding that our volumes are significant. So for example, today, we have over 60 patients in the hospital today, and that is about 20 more patients than we typically would have this time of year. And to keep patients local, as we talked before, one of the strategies that we put in place to allow us to care for our community and open up additional beds is creating some new staffing models. And so I'd really like to talk to you about that, if that's okay.
Absolutely.
Okay.
I was going to say, so we're in a new normal, right, from post-pandemic, but staffing is still really tight.
Right.
Just like I see across my membership, that's the number one concern that every business has, is staffing. And then nursing is a whole another thing, because they were frontline workers. And so please tell us about what you're trying to do to mitigate that issue and make things better for just moving forward. And workforce development initiatives are key for us. So we'd love to hear about what you're doing.
Yes, so what we're finding in healthcare is similar to other industries where traditional roles, we just are very challenged in finding qualified candidates. The skilled areas like nursing, which requires a license, we're finding that there just are not enough nurses to hire. The demand is very high for nursing. The supply of candidates is very limited. So at Annie Penn, we actually piloted a program that now we have put in place permanently, where we have hired licensed practical nurses, so LPNs, and LPNs will work with a nurse, and also they will work with nurse techs to care for a number of patients as a team. So it's a team approach to care in the hospital. That has enabled us to increase our bed capacity. And so we're able to keep patients local, where, in the past, patients may have been needed to go to Greensboro by an ambulance. So we're really excited that we can offer additional inpatient beds for our community if they're needed.
That is really fabulous. And so I think that we all hope that moving forward, that things start to work themselves out. And I think that's career changes is something that we're hearing a lot of, is that people decided that they wanted to, life became very, appreciate what you have today, think about what tomorrow looks like. And maybe I don't want to continue doing what I'm doing right now. So there's been, the great shuffle, right? And so I think that being able to talk about what you're offering, I think people can see that as a team approach. That sounds like something I would want to be a part of, right? Versus I'm solely responsible for my patients. Not that it wasn't a team effort before, but having those folks that you right there can call on and say, hey, this is what's going on down in room 210. What do you think about this? Like, this is what I saw. Do you want to go check on them and follow up? Like, what's our plan of action? And being able to then go to the doctor and say, hey, this is what we saw and what we think. That's really neat. I'd love to see that be something that we continue to talk about, so that folks know that you're trying very hard to keep folks local and to keep this, moving forward, because we have to have a hospital. We have to have that response. And right now there's a lot of people wearing a lot of hats trying to make things happen.
That's right. A couple of other things that we're doing is we're beginning to train our own and sort of cultivate our own staff and their ability to take on new assignments. And so our medical group recently graduated their first class of certified medical assistants. We were not able to get students and find enough candidates to hire, so they created a program where we trained our own staff who were interested in being in that type of role, and those roles would work in the clinical practice where the physicians have their outpatient offices. So we're doing all kinds of things like that. The final thing I'll mention is that with the nursing shortage, we have created a travel pool of our own, meaning that employees who are interested in working at multiple campuses and they're willing to increase their competency level in specialties, they become part of our travel pool, and they move from campus to campus based on where the need is. And so that has enabled us to be much more nimble and flexible in filling our vacancies.
That is really a smart thing too, because people's level of their willingness to get in the car and drive, or their willingness to be able to be flexible if their home situation allows them to do so, that's wonderful. I mean, and it gives them a change of scenery, right? So that probably makes some of them happy if that's what their in their personal craving is, to see a different day and a different atmosphere and a different campus and work with different folks. That's a really cool thing too. That's a cool initiative.
Yeah.
So also, one of the things that I guess I wanted to bring up is, I think you were talking about all the things we learned, and I've said this repeatedly, and I know that other people feel this way too. We learned a lot of things, right, about hand washing and masking and things that were things we kind of already knew, but that a lot of folks weren't really a fan of, or weren't really sure, that they should be enforcing it in certain situations. And I think we will see that continue to move forward. And it's like I was explaining to somebody, I don't ever expect to go into a doctor's office from now on without wearing a mask, because in a primary care facility, unless like when you're pregnant or when you have small children and they're going for well checks, there's a sick lobby and there's a well lobby, and if you're just here for immunizations. And I just think that there are things that the health care facilities were requiring, right? But like the general public wasn't requiring. And I think that we'll start to see people treating COVID and the flu and other sicknesses all kind of similarly, and trying to, and I hope from a perspective of the chamber, that our businesses continue. So we have a program that we've been working on with the Family Forward, and trying to make it more, what's the word I'm looking for? We want it to be accessible. We want families to have what they need, so that when they're at work, they feel like their families are cared for, and that we are providing opportunities for them to care for their families and make sure that they are well and that sort of thing. So I'm hoping that our businesses start to say, hey, if you have a sick child, it is okay, stay home. And obviously some of them can't do that as well when you have industries and you have things in their production lines and they're trying to make a product, and that has to keep going, and they're already short-staffed. And those are the kinds of things that we're working with the Reidsville Area Foundation and the Rockingham County Partnership for Children on. And to see that you all are taking on so much inside your own hospital, inside your own system, makes me so happy, because it's that we want examples like that to say, hey, like, they're over here caring for the sick people, and they're still making things work. Like, they're still trying to find ways to keep staff and to keep them happy and to help them grow, like you said, in their specialties. So that's just, to me, those are the kinds of things that are going to keep our young people here. They're the kinds of things that we're going to continue to train our workforce and make them happy. So it all fits together, right?
Absolutely. Yeah, you're right. And the COVID response with hand washing, masking, social distancing, all of those things were tremendously difficult to work through, even in our industry. We had to really ramp up our protections during COVID, and we continue to do that. With that said, as we've moved through the pandemic, we're beginning to find ways to have sort of a hybrid approach when we can have, there are opportunities for us when we're not in the hospital to have meetings where we're still socially distanced, and there are occasions where we don't have to mask. In the hospital facilities, we do have to mask, and we do follow CDC guidelines in that regard. One of the challenges that we've really faced that we've tried really hard to address is how to continue to stay in touch with our patients' families, while they're hospitalized. And a couple of things that I'd like to mention is strategies that we have put in place. So at the height of COVID, you're probably aware that family members were not allowed to be in the hospital. And that is, I've never really seen that in my career, where we've had to take that kind of extreme measure. It was necessary given the spread of the virus. And it was a strategy that we had to put in place to control it. With that said, it's important and that families be able to connect with what's going on and that we keep them informed, not only for communication, but also because that connects with our patients' ability to improve. They want to feel that their families are connected to their care. So we used iPads. We took some iPads and put them on wheels and taught our physicians to be able to use them. And so they brought them into the room, and we could do a social sort of interaction, like a FaceTime sort of interaction, where our physicians could talk with the patient in the room with families. And so that was just one of our strategies that we put in place to really stay connected.
So one of the great things about some of the things that you mentioned about the team and the medical assistant and training your own, but then having the team approach and having the LPNs working underneath the RN, that ties it all back to those folks being able to attend RCC and be able to get their certifications there and then come work for you, which I'm a huge fan of. My mom did that. When I was in school, she went to RCC and got her nursing degree and then got an Annie Penn scholarship and worked there. So it all ties back, right, and keeping our young people here. So tell us a little bit about how the LPN, how that works, and how quickly they can become an LPN and how that helps, how that helps bring that transition in for those folks to quickly be trained, because it's a little bit shorter, right, than the whole RN process. So tell me about how that works.
Absolutely. So you raise a really important point, and that is that the community colleges, and Rockingham Community College specifically, they are so important in developing and cultivating a workforce for the healthcare industry. And so we are very thankful that we have a wonderful college here that we are able to partner with in this regard. So with the LPNs, our potential students in high school can make a choice and a decision to go into the healthcare industry, enter into the community college through the LPN program, and then become part of our organization at Penn Health, working under the direction of a registered nurse. So it's a wonderful career path, and one that I think will grow over time, not only at our facility, but potentially in other Penn facilities as well.
That's really cool too. You mentioned the word career path, which is a big deal when we're looking at the school system partnering with the workforce, partnering with RCC, and sometimes we're doing it a little bit different, right? They're starting out as an intern and they're simultaneously being trained and working while also going to school. But that's a really neat additional career path. So thank you for sharing that with us.
Absolutely.
Well, we're running out of time, and I want to be sure that you have been able to talk about all of the things that you wanted to mention. Is there anything additional that we didn't cover that you'd like to share?
Well, I'd really like to just emphasize how much we appreciate the opportunity to serve the community, to be right here with the chamber, to be right here with the residents of Rockingham County, to be their choice for health care. Annie Penn Hospital has been in this community for over 90 years and part of Cone for more than 20 years. So we continue to strive, continue to move forward, and look forward to our sustainable health care in the future. But thank you for having me here today. I really appreciate it.
Thank you. I appreciate you as well. And we have a long, rich history and partnership. The Chamber's been in existence for over 100 years. And so going way back, Annie Penn was one of the very footstones of our community. And so thankful for Cone Health and being able to partner and become a part of the system and what it's brought to our community. So thank you for stepping in when we needed you the most. And we're really looking forward to all the things that the future holds. And happy anniversary, since that's happening now too. So I'm so excited for you. So thank you
so much. Thanks.
That's it for News and Views today. Thank you so much for tuning in. As always, you can find us at 140 South Scale Street, right in the heart of downtown Reidsville. You can find us on Facebook or at our website, www.reidsvillechamber.org. We will see you soon.